Hi, welcome to the first CJL Spotlight Live. We are going to be joined with Nadine Ashby.
Hey,
Thank you so much for going through this with me. I
of
appreciate
course.
you. All right, how are you doing?
I'm doing all right.
Okay. All right, so my name is Metadel. I'm a CJL student coordinator. And at Hamline University, this is going to be the first CJL Spotlight of 2021. And our theme for CJL is health, justice, and the law. And this spring semester, we're focusing on birthing and all the different facets of birthing. And I've asked Nadine to join me because Nadine is a birth worker, as well as a community perinatal, educator, lactation educator, and founder of Birth Revolution. But I'll let them introduce themselves.
Yeah, hi everybody. As Metadel said, my name's Nadine. My pronouns are they, them. Um, I am a birth worker. Um, I do a lot of work around advocacy and anti-racism, and bringing that work into like the birth world.
Okay. Um, One question that I have is like, how do you feel that your work kind of ties into this year's theme of health, justice, and the law? I think there are a lot of connections, but I'd like to hear how you think about it.
Well, I think that, you know, a lot of our autonomy and our rights have been infringed on in the birth world, especially as Black and Brown people. So teaching people how to advocate for themselves and being a person in the room who um, knows how to work around the systems that are in place in order for clients to get the things that they need is huge, I think. And I mean, this is about keeping people healthy. This is about community care. And as far as the law goes, I mean, I think that the law plays a huge role in reproductive justice.
Mm-hmm. It does. Um, I think some one conversation that we had that was really interesting and incredibly eye-opening was the historical origins of birth work, as well as the historical or the etymology of the word doula. I was wondering if you could kind of speak and educate us about that because I think that informs a lot of where we are today with birth work.
Yeah. So as far as the history of birth work in this country, Indigenous people have been doing this work and doing community care forever. And, African folks have come over and we have exchanged, even before, well before colonialism, have exchanged information and practices with Indigenous folks to this land. And then once kind of colonialism happened, and a lot of, people think about um, slavery and they think about people just being grabbed at random. And that wasn't always the case. A lot of these people were skilled folks. And so we brought our birth practices here and our knowledge of herbs and wellness here. Um, and so throughout enslavement and all of that awful, torture and things, we supported each other. And our granny midwives, who are sometimes called grand midwives, loved on people and supported people. And also, a part of that birth work was helping people with abortions and
Mm-hmm.
using herbs to help people in that way. They also helped, were forced a lot of times to help their kidnappers.
Yeah.
Um, and so we move into, right, these skilled workers, we move out of slavery, right, into that like post-slavery period,
Mm-hmm.
and people didn't have anything. People weren't even able to go and get health care at all. Um, and so the granny midwives were the people who took care of everyone. You had a cold, you had the flu, you go to the granny midwife to get care. And this continued on until white folks realized that you can make money off of birth work and off of Black people, healthcare systems. Um, and so there was a big push. There was a lot of propaganda put out to say that granny midwives were dirty and unskilled and like witch doctors, whatever,
Yeah.
Um, and so they were kind of demonized. And then we also, in all of this, have to talk about the role of white women.
Mm-hmm.
Um, a lot of Northern white women saw, oh, these Black people are dying in childbirth, and we have to do something to help them. And so they would come down and do these trainings, training these granny midwives, these Black women who were highly skilled
But already had been doing this for generations.
and had been doing this since the beginning of time on how to adequately catch babies. And they were effectively kind of like regulated out of practice.
Wow.
But of course, under wraps, a lot of them continue to serve their communities because who else is going to serve
Yeah.
Black people? Um, and so that kind of brings us a little bit closer to modern times.
Mm-hmm.
And for a long time, people really, especially Black people, avoided the healthcare system altogether because it was racist.
Mm-hmm.
And it still is.
Very much so.
But kind of more after the civil rights movement, a lot more Black people started to go into the hospital system to have their babies. And now we're kind of seeing a little bit of a shift the other way.
Yeah, I was going to ask you about that because we have such disproportionate deaths of like maternal deaths. The maternal mortality is egregiously high in this so-called first world country, for Black, specifically for Black and Native women especially. And so I'm wondering, has there been a resurgence, or is there been a significant like resurgence of us Black and brown women and Indigenous women and people who give birth, like going from, the hospital to, or just to also plugging into having somebody like a doula, a birth worker? Um, do you feel like that there's like are significant numbers of
Yeah,
that kind of exodus?
yeah, definitely. I think a lot of people are realizing the scale. There's just the sheer scale at which Black folks and Indigenous folks are dying at hospitals because people are not really listening. Um, and I think that the research is really getting out there. A lot of people like myself and a lot of other birth workers in the community are doing the work of like taking this research and making it understandable
Yeah.
for so that they can get a doula or change their birthplace, and in the hopes of having a better experience. What I see a lot is, and this is kind of off topic, but what I see a lot is Black and Indigenous folks just saying, well, as long as I'm healthy and my baby's healthy, that's all that matters. You know, like the bar is very low.
Yeah.
Um, and I think that because of the research that's coming out and the birth workers who are doing that work of translating, sometimes like just inaccessible language to
Yeah.
people, a lot of people are deciding to have a different outcome. They don't want to just, I don't want to just survive this. I don't want my baby to survive this. We want to thrive. And so I think that's beautiful. People are going back into their cultures.
And I feel like your training program, Birth Revolution, is a direct response to that. I've a direct response to so many people. I mean, all my friends who have had babies within the past 2 years, they've all had a birth worker. But that's like on their team. Like some people have had like birth worker and they've been in the hospital setting as well, or like all that kind of stuff has kind of I've been seeing that just in my personal life of that happening. Can you talk about why Birth Revolution is and why it matters, especially in terms of what does because when I think of a doula, when I first looked into it, it was like a lot of white women who are doulas, and it was very white. And so when I looked up Birth Revolution, I got excited, and the more I've been learning from you, it's very much going in a different direction. And I want you to kind of talk about that and let our viewers know about it.
Yeah, of course. Um, Birth Revolution was really a response to, B and I had been thinking about doing this for a long time because we could see the segregation
Mm.
in the birth community, and we could see the ways that there were these huge barriers for Black, Indigenous, and other people of color to do this work that we've been doing,
Yeah.
um, because of the gatekeeping, because of the costs, um, because of how white and straight and cis the training is
Mm-hmm.
that is available a lot of times. So we decided that, you know, who's going to do it if we don't do it? Um, and in this training, it's our goal to focus most of our attention on anti-racism, queer experiences, trans experiences in this work. And it's really, we want this to be an intersectional experience, truly intersectional. So we're talking about ableism. We're talking about like all of the different barriers that show up and how we as birth workers can work through those things, not just with clients, but in our everyday lives. How do we combat these things?
Mm-hmm.
And also, a big part of this for me, I think, is connecting with other BIPOC birth workers and developing an understanding that we don't have to carry this alone,
Yeah.
that this is a community thing, and we all have something to offer. And also coming up with strategies so that we can get some damn rest.
Yes. Yes. That that I think has to be the center of everything that we do in 2021 and moving forward is prioritizing rest and destigmatizing it, because too many of us are just getting completely ground down by all our responsibilities and everything that we want to do and the good things that we want to do, but making sure that our bodies, our mental health, is centered in that.
Yeah.
I love that. Something that I really love about Birth Rev is that you, on your website, it says that it is completely free for Black and Brown and Indigenous and queer and trans folks to be able to take the training. I think that's huge. I think that that is like blowing accessibility out the water and saying, no, this is going to be the new model. And I think that's really exciting. And I'm wondering how are you going to do that? How does community plug into that?
Yeah. So yes, it is going to be free for Black and Brown folk. Um, and the way that we are doing that is by having white people pay for it. If you want to do anti-racism, like the first step, right, outside of educating yourself, is paying your reparations.
Mm-hmm.
The state isn't going to do it. The government clearly isn't going to do it. If you really are invested in supporting Black and Brown folks, support with your wallet.
Mm-hmm.
And so that's kind of the model that we're going in. And in this training, and every time that white folks reach out and, they love to reach out and ask what they can do, what they can do,
Yeah.
dedicating a portion of every piece of money that you get, dedicate a portion. I'm going to always donate this percentage to
Yeah.
either directly to Black and Brown folks or to Black and Brown organizations.
Mm-hmm. Yeah.
So that's how we're going to do this.
Yeah. And I think that that has to be the model. Like, if you want to be anti-racist, if you want to live in a world that has eradicated racism, like you have to be able to commit to the actions of anti-racism. Like anti-racism is a verb. And I think like love is a verb and justice is a verb. So you got to do it. And so I love that call to action. I think that's really, really important. I think something I kind of want to tie back into is the training accessibility as well, because I think this is something that Birth Rev is also completely undermining. I've I've talked to people who wanted to be doulas, and they couldn't afford the classes for the training, and then on top of that they have to, and this is I'm not an expert, so correct me, but like they also have to have certain amount of hours of training where they are observing somebody, and that having access to like who they can observe and having those relationships requires like networking and just kind of so much there's just so many barriers to actually being able to become a birth worker, and a
Mm-hmm.
lot of it has to do with money and who you know, and since it's very white cis world, um, I'm wondering if you can kind of speak to that, or if I have that understanding wrong of how to become a birth worker.
Yeah. That's a huge barrier. Payment is a huge barrier. Also there's some hoop jumping around being able to write well.
Huh?
Yeah. So like reading material and then having to like write, essays about why you want to do this work, and writing kind of like book report type of things about, what you've read. I understand the reasoning behind that, but I think it's important, if that is how people want to qualify a doula or something, there have to be different avenues. Not everybody's a writer,
Yeah.
you
Yeah.
know. Our educational system, racist as ever.
Speak your truth.
I'm trying not to cuss.
I say whatever you No.
Maybe it's having different ways that people are able to communicate information is important.
Hmm.
You know, also having people, you gotta write a bunch of stuff to get a scholarship or have some kind of like sad story
Yeah.
about why you can't afford um, the training. It's just, it is, in my opinion, white supremacy culture. Like, I don't want I don't want lynching postcards. I don't want people to have to jump through these hoops and relive
Yeah.
trauma and things in order to get a scholarship to do the things that they feel like is their calling.
Yeah.
So we're not doing scholarships at Birth Rev.
Yeah. I love that.
Because why? If you're black, brown, come on, let's do the things.
Let's go.
You don't have to prove to me that you deserve
Hmm.
because it's inherent. This is your birthright.
I love that. That's the truth. And I think that what you're doing is so needed. I don't know of any other organization that is training specifically Black, Brown people um, to become birth workers. So honestly, thank you so much for thinking about doing that, for do all the work that goes into that. Like you're already putting in so much of that work. Before we go, I think we've kind of talked about it, but how can we support you and how can we elevate the work that you're doing with Birth Revolution?
Yeah. Donating to the GoFundMe so that we can continue to do this work and also pay. I mean, this stuff is not, this isn't me and B teaching people how to be doulas. This is us coming together and sharing all of our collective knowledge. This is community based work. And so we want to be able to pay the other birth workers in our community who have been doing this
Yeah.
and who are wonderful educators to share knowledge with all of us. Um, and so donating, also, we have a petition going right now to United Health Group to get them to cover more out of hospital birth, especially home birth for people, so that people just have more options.
Yeah. Okay. How could is it so that petition, how can we access that petition? And is your GoFundMe link in Birth Rev's bio
It
on
is,
Instagram? Okay.
yes. And I can send that petition so that you can share it.
Okay. Thanks. Please
Yeah.
do.
And I also want to give a shout out to all of my like the black and brown birth workers who have taught me a lot of things and helped me get to where I am and not feel so isolated in this work. Um, so shout out to them. Sumi of Sumi's Touch. Shout out to her. Akamir, give you a shout out. Rhonda was in here. Hey girl.
Yes, let's get all the plugs in before we sign off. Okay, so just to recap, there's a petition to get United Health Group to expand their coverage to also cover in-home births, and also donating directly to the GoFundMe so that we can help make Birth Revolution training accessible for everybody and make sure that people are getting paid what they deserve and what for the knowledge that they have and the ways that they are already helping to heal our community. So thank you so much, Nadine, for being on this, and thank you for riding through this with me, even through the troubleshooting mishaps. I appreciate you. All
Yeah.
right.
All right. Have a good day.
You too. Bye, y'all. Thanks for joining.